And welcome to our live stream at Deuk Spine Institute. It is now November 2nd, 2023. Actually, it's not a live stream. Unfortunately, our internet is down, so we're doing a recorded broadcast. So you will see this after we get our internet back up. And
construction issues, or they don't know?
we don't know why. Typical internet service provider nonsense. Just, who knows? Saving money. Somehow they profit off of it. I don't know how they profit off of it, but they do. Shot? All right, so I'm trying to enter the L3-4 right now. You can see the stimulator that's there. You guys see that? Show us the stimulator, Jordan. That's correct. So that's a spinal cord stimulator generator. And that thing sends an electrical signal down to her through some wires to her spine. And the problem with them is they often will fail. And when they do fail, you don't get much relief at all. So you had this very expensive, very invasive procedure for no real reason, no benefit. Shot? All right, AP. But it's also an invasive procedure, and it's a dangerous procedure. We don't recommend spinal cord stimulators at Deuk Spine. We don't recommend them because they don't really work. Shot? Yeah. All right, you can see we're at the L5-S1. I'm at the back of the disc, and we're going in. Is she awake yet?
Hello, how are you?
She's doing great so far.
Do you have a few questions? Hi. You doing okay?
All right, we'll give her a minute to wake up. So far, just so everybody understands, she's having really bad back pain in this area, kind of right where her little tattoo is, and I won't say anything about the tattoo. I don't want to give away her identity. But she's got these 3 discs in her lower back that I saw on the MRI, and these 3 discs are the L3-4, L4-5, and the L5-S1 disc. Those are the bottom 3 discs in the spine, and they're the most common ones to be damaged, and they're the most common ones to cause lower back pain, which she's had for 7 years, folks. 7 years. That means she's been suffering for 7 years, taking medication that won't work for 7 years, having treatments that don't work for 7 years, even invasive treatments like stimulators. Okay? So we're going to fix her pain today, and it's going to be fixed for the rest of her life. All right. Is she awake? All right. Take your time. We're going to wait for her to wake up. Once again, we're not broadcasting live because we don't have internet. They're apparently out there digging around a few streets over, and they cut the cable. So we have no phones, no computers, no broadcast. All we can do is record, and we'll put this on YouTube tomorrow. Right, Henry?
That's what we're looking into. I mean, like, it's definitely up in the air of what's the problem, but we're trying our best.
There's a cable that's cut.
Oh, that is okay.
Right?
Yeah.
Well, I mean, what else could it be?
Honestly, that's like what I'm thinking of. I'm like, it's either a wire cut, a tree falling on some like on some technology that that connects our internet, something. And
aliens with lasers?
Aliens with lasers.
Aliens with lasers have been seen in the area.
Yep.
They have faces that look like shriveled pears. They have slanted eyes that look like gumdrops. All right?
I believe it, yes.
And instead of ears, they have impressions on the sides of their head. This is what they look like, folks. And their bodies are all shrivelly and wiggly like this. And they have lasers. And those lasers have been aimed at the network cables. So that's why Huh? Right? And they don't walk, folks, they slide. Anybody ever see anybody any, sliding aliens with lasers have taken out our network. The big N, gone. All right? They're here for our network. So because of that, we have no network. We have no way to communicate with the outside world. We're trapped here. But we can still operate. Is she waking up? All right. So we'll just talk for a minute. What is the most common cause of lower back pain? The disc. 85% of chronic lower back pain comes from a damaged disc, or 2 or 3. 3 in her case, 1, 2, 3. 85%, folks, 85%. So fix the disc, you fix the back pain 85% of the time. 10% of the time it comes from the facet joints, okay? And that gets you to 95%. You get about 3% coming from the SI joint, and you get 2% plus or minus a half a percent from the piriformis muscles. Huh? She's got them all. So, did she get her piriformis shots yesterday? She got
the piriformis today.
today
And
from
SI,
Francis
we're gonna
Cheney.
do the SI tomorrow.
All right. So she doesn't just have pain from her disc. She's also got SI joint pain from arthritis. She's got piriformis muscle pain because she has a tear in her piriformis muscle. Now, we did the shot. Was it bilateral?
No, I believe
Just right. So we did the shot in the piriformis muscle. She's getting this when?
tomorrow.
And
You fixing a disc today?
we're just fixing her disc today. Are we almost ready?
Hi, can you open your eyes for me? Cool. Hello? I'm gonna ask you some questions about the discogram. Can you open your eyes?
Open your eyes.
Open your eyes for me.
All right. So I guess I was a little too fast. Huh? Dr. B? I need to slow down a little next time. Now she's got, I'll tell you this, she's got an incision here where they took her lamina out, took her spine out, and basically slid a lead electrode over her spinal cord and then connected it by wires to a, yes, it looks like the alien, to the generator over here, which is a computer in her body. Totally unnecessary. We don't like generators. We don't like stimulators. How are we doing, Doc?
Open your eyes for me?
Still sleepy, huh?
Can you open your eyes? Hello?
That's going to be a painful one. I could tell you that right now. Yeah.
It looks like it's squirting easy.
Now you can see the tear in the back of the disc. Show us the tear in the back of the disc. You seeing this, Henry?
Yes, yes, sir.
So there's the tear. That's where all the back pain comes from. And then you got 2 lumps. Those are the 2 herniations. Let's go ahead and show our audience a video, Henry, of how does a herniated disc cause back pain? All right, we did our discograms. You could see the tear shot.
Difference in her
And we're going to go ahead and proceed. She's sleeping nicely. So we could see the tears. We know where the pain is coming from. We're going to go fix those right now. But I didn't get to report a level on her discogram because she's so sleepy. And we waited about 5 minutes to no avail. I'm happy she's asleep. Shot. It's always better the patients are sleepy for the procedure, more comfortable. It's nice to get the discogram result, but I feel confident we're treating the right thing. Yeah. At this point, I'm bringing the dilator down. Shot. We're heading down to the first disc we're going to fix, which is the L4-5. Shot. You see we're right at the back of the tear. Shot. I think the 3-4 tear is going to be even bigger. That woke her up. Take the guide wire. Come on. Are you waiting for an invitation? Shot. She's a good sleeper, huh?
She is.
Out. Alrighty then, we are now inside the tear. The first tear we're going to fix today, left L4-5. We're going to move on after this to the 3-4, and then we'll go to the 5-1 last. I need the scope. All right. Thank you.
You got it?
This is L4-5.
Yes, sir.
Laser. Scope looks good. Which one? We got Ohio?
No, this one is number 3. This is
Number 3, all right.
yeah, we are rotating.
I like it.
That's okay?
Yeah, rotate them.
Yeah,
It's fine. Whatever you want. I don't have a preference. Is 3 the 60?
yeah.
God damn.
Do you want
These
to be
pedals
number
have to
one
be.
or should we
Who's
do-
putting the pedal here? You got to put it so it faces me, not faces north, okay? Otherwise, I have to stop what I'm doing and readjust it, which I've had to do every time. It's grabber. Come on, you got to pinch. You don't just open your hand. Pinch. Okay? There. You know how many of these surgeries I've done? Huh?
Almost 1,800.
1,800. So do you think I've developed some ways of doing it that I don't want to change?
Yes, sir.
And so when you change what I'm doing, you think I'm going to be happy about it or not happy about it? Let's say you made a change that was better.
That would be a good thing.
I'd be happy.
Yeah.
All right? But you're not ready to make a change that's better yet, I don't think. Maybe you will. But so you've got to learn the right way to do it, my way. Okay? Then you get to be Luis's level. Then you can start making changes that improve things once you understand how I like it. All right, but until then, you better do what you're supposed to do the right way. Does that make sense?
Yes, sir.
So when I put the grabber in your hand, you don't just sit there with an open napkin staring at it. Have you seen Luis do that?
No.
All right, do you know why he doesn't do it?
It's the way you like it.
Okay, it's simple. It's better to open your hand and stare at it, or worse to open your hand and stare. Good. So why would you do that? See how easy life is when you make decisions better, worse, better, worse, better, worse? Right? Pizza. Better cold or better hot? Huh? It's personal preference, right? But you have a personal preference, whatever that is. Okay? You're going to have pizza the way you like it, right? That's your pizza. You get to do that. I have my pizza the way I like it. But when it comes to the surgery, you don't get to choose what you like. You have to do it the way I like it. Okay? You're supporting me, right? If I was making pizza for you, what would I do? Huh? I make it the way you like it. Well, how would you feel about a chef who made food for you the way he likes it, not the way you like it? What if the way he likes it is the way you like it? Then it's fine. But what if the way he likes it is different than the way you like it? And it's worse. Then it's not fine. But if the way he likes it is different than the way you like it and it's better, then it's fine, right? You understand?
Yeah.
So when you come in here, you have to do it the way I like it, not the way you like it. Until you find a better way to make my pizza. Then you can make it your way. Don't pull. Do you understand? Do you see the way Luis grabs it? There's a reason he grabs it that way.
Trying to get the pinch down.
Well, the first thing is you have the wrong grabber. Okay, you have the wrong napkin. Why?
It's just wet.
It's too wet. Okay? Wet napkin is not going to grab onto the pieces of herniation. A dry napkin is going to grab on. These are all the details. You all don't understand what a neurosurgeon really is. It's a human being that pays attention to every little detail. You guys aren't trained to do that. Your lives don't ask it of you. But when you come into the operating room and you're supporting me, you have to become that new person that you never were before, paying attention to details. Okay? And if you can't do it, then you don't belong here. Okay? It's not, I'm going to change to accept your failure. You have to change your failure and make it a success so that you can support me. That's what's supposed to happen. Does that make sense? It's easy to come into the operating room and say, I'm going to do it this way, and that's the right way. It's not the right way. You have to pay attention to Luis and see how he's doing it. You understand? Yeah. Luis will show you the right way. He's been doing it in front of you for now. How many surgeries have you been in? Just pick. 30, 40?
Maybe.
Huh? 30?
Yeah.
So it's 30 times. If you're watching him carefully for 30 times, you'll see the details. What was that? Did you see something crawl across the screen? It was funny. I don't know. I don't know what it was. I think it was just a bubble or something, but... Hey, Henry, did you see something go across the screen?
It was very faint. I didn't. It didn't look like it was bothersome on my end.
All right. Well, I know we don't have any questions from our audience. Or maybe we do. Does Sanjay have any questions?
He is still currently on the phone, and so at the moment,
He's on
No.
the phone.
I believe so. Yes.
All right. Why don't you get him over here?
Copy
I'm
that.
not sure what he could possibly be on the phone for that long. Huh? But what is Orlantech doing? There's nothing they can do. There's no internet access. Right? So the only way Orlantech can fix our network is through internet access, which they don't have. Unless there's something happening I don't know about. So yeah, I'd like to know what he's so busy doing.
I agree. I just texted him. I'll call him in a moment.
Thank you. All right. just about done with the first disc. Yeah, neurosurgeons, just so you all know, we're control freaks. You know why we're control freaks? Because very bad things happen to the human body very quickly and very easily, especially when they're having spine or brain surgery. And just one little thing changes too much and people die.
Dr. Deuk, Sanjay is working around with Orlantec. He's on the phone with them, and he's working around with the wiring and all, and just trying to figure out what to do, just on the phone, and that's where he's up to right now.
All right, but I'm just curious what they're working on. Do you know?
Plug out some switch.
Are they, I mean,
They're asking him to to plug out some switches.
Oh.
Yeah, just
but
doing some
is this a
adjustments.
problem with our network here? I thought it was like the whole area went down.
I think this is a diagnostic just on our end, so
I
just
see, I see.
yeah, just trying to test it out, see if it is coming from our end, but I don't think it is.
All right. All right.
So he's just
Can
doing
you
that for
find out who he's on the phone with?
Ivan. He just said
Ivan.
Ivan. Yep. And he's just doing that for right now.
He's what?
He's on the phone with Ivan right now and just
That's
trying
fine.
to sort that
That's
out.
all I need to know. Thank you, Henry.
All good, no problem.
All right, Dr. Berndes, almost done here with this first disc. Well, our first guy seems to be doing very well. Right? I just saw him. He looked good. Watch your you can't put your hands there. I'm coming in with this. I could hit your hand. Okay, wait till I go in there, okay? It's all about timing. Now, I'm going to want to take this with my left and take that with my right. There you go. Watch that. Bring the fluoro in. Watch yourself. Shot? Let's bring that window down, please. You have way too big of a window there. Shot? Shot? No, I might have gotten a little around the nerves, so. What's in there? Marcaine? She may have a little caudal block. Berndes? You hear me? Yeah. I was injecting and it was by the foramen, so I didn't have much resistance. It may have gone up. Just keep an eye out for it. Any changes in respiration. So far, so good.
How much did you put in?
5, 6, 7. I mean, I don't know how dilute it is. I don't know how many milligrams. Just let me know if we need to do anything. Well, I worry about it ascending and like one of those caudals that go too high. Huh? Yeah, I don't know if you're concerned about the amount that I put. Okay. So this disc is fairly damaged. Let me have the grabber. I think this is the worst of the 3. Like structurally the worst. Let me have that back. When I was a resident in neurosurgery starting out, you never really understand just how much detail there is in our actions, our thought, our behavior, until you have a neurosurgeon writing your ass for doing things wrong. And then you learn quick, you know? I was doing something that Luis knows a little bit about, but not a lot, and that was irrigating while my attending was bipolaring on the brain. And whether you're bipolaring something in the muscle that's bleeding, or something on the dura that's bleeding, or something in the pia that's bleeding, you bipolar differently. There's nuances. And I always have to drip drips of water from a syringe. Drip, 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 drip. And if you drip too much, the bipolars stop working because there's too much water. It dilutes the current. And if you drip too little, the bipolars stop working because you get char on them. So you had to drip the exact right amount of drips. And you had to drip it in such a way you don't block the surgeon's view. You can't drip it so it drips down the tines together of the bipolar, otherwise it short circuits the bipolar. So as you get closer to the tip. So there's an exact technique, an exact drip rate. And you never knew just how detailed anything could be until you do neurosurgery. Then you realize that neurosurgeons actually pay attention to the tiniest details. The good ones, not everyone. Because they change the outcome. If you don't do it just perfect, you have a less than perfect outcome. You go back to the Stone Age of operating. Look at that. We didn't evolve all this ideology and technology just to have it destroyed by people who don't appreciate it. Huh? Isn't that right? You want to go back to the days of alcohol-induced anesthesia? It is literally a pinch. Pinch and pull, pinch and pull. Not, you're not mixing cake batter here. Here you go. So there's the tear. We're getting close to the end of the tear. This is called a debridement. We're removing the herniation and whatever's come out of the center of the disc that's stuck in the tear, keeping it from healing. How are we doing over there, Henry?
So far so good with everything. At the moment, I'm in on recording end with with the Orland Tech. Sanjay is still working with them.
The internet's not back up.
Yeah, it's going up and down. Like I'm in front of my MacBook right now, and it's going in and out. It works sometimes, and slows down.
And your MacBook is connected to our wireless router.
Yes, sir.
So basically, the wireless router is showing you that we're still having problems.
Yeah, yeah. I mean, I'm still able to get on the internet, but it's just slower than per usual.
We're a bit overexposed on the scope. Can you guys reduce the light intensity? It's just too bright. Why is it always so overly bright, Luis? That's good.
That's it?
So, what is someone changing it?
No. It's sometimes when I try to do a white balance, I try to. It might be you. Probably I ordered
So you were changing it.
Yeah.
Okay.
When I do the white balance.
That's it. That's what I thought.
Yeah.
We'll change it back at the end of the white balance.
Okay.
Just do the white balance and then say reduce by 3 presses. That way I don't have to deal with doing it myself. I got other things to worry about. Thanks for letting me know. Good job.
That's what the bubbles are?
What?
That's what the bubbles were?
Yeah. Yeah, because if you don't stop pressing the pedal for a second, right when the bubbles come, then the laser will literally snap and you can even have a fire potentially. You understand?
Yeah.
Because when the irrigation stops, we're still sucking, right?
Right.
And so you can actually replace all that liquid with bubbles, air, right there again. You see that? I had to stop. You have to have some fast reflexes. You can literally shoot the laser out across the disc and cause problems for the patient. You can also melt the tip of the laser. The glass can melt from the laser energy and shatter. You ever seen that happen? I have. It sucks.
Now I understand.
There's a lot of little details in neurosurgery people don't appreciate. And it's not my job to teach them. I had to learn myself by watching carefully, studying every move. Nobody took me under their arm and taught me. You understand? So I expect you guys to pick up things too by watching. You can't learn just what I tell you. You have to learn what you learn from observing,
Right.
how we do it. That's how you learn, observation. So, Luis, something interesting's happened. The lady that sold us the sterilizer,
Yes.
they fired her. Mm-hmm.
Somebody else wanted the commission or what?
I don't know. She said that they're downsizing and they're getting rid of their ASC salesperson. So, anyway, long story short, I need you to shoot off an email to say, just want to make sure we're still on track to get this product, right?
No problem.
You remember which one she's with? Gettinga?
Yeah, 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 yeah. No, I am.
Yeah, I mean, I have the contract signed and everything, so, but she just told me yesterday. I was texting her saying, can we get some help with training, sterilization training? Somebody to come and look at what we're doing, make sure we're doing it right, you know, just a consultant. Which we're doing it right, I'm sure, but it's good to have an outside set of eyes come in every once in a while. Just look over things. Anyway, I shot her a voicemail. Hey, I had some questions about sterilization and consultant, and she sent a text back saying, I just got let go of the company after 7 years being the #1 salesperson. I said, I'm very sorry to hear that. She goes, it shouldn't affect your purchase, you know? But, oh, let's go here. Just a little more.
I got it.
But who knows, right? So we need to make sure there's no issues there.
No problem.
All right, looking good. I think we're pretty much done with this one. We're going to go to the other side. Sanjay still working over there with Ivan?
I believe so. I'm texting him right now.
Nice.
He texted back, yes.
Come on, Jordan. Oh. True or false, the green light is a laser. Can't pull the wool over Jordan's eyes. Just not the kind of laser that does anything inside the disc, right? All right. You're going to close the other side out? Shot? Any issues, Dr. B? Shot? You know, can you run the video on how the Deuk laser disc repair actually works? All right, welcome back. We have shifted to the other side, and I'm pretty amazed at how shallow her spine really is. We were just talking about that while you guys were watching our video. But her spine is very shallow, meaning, yeah, laser. We're going to be done quick on this one. There's not much to do at 5-1. Meaning her spine is very posterior. More posterior than I expected. You can see some degenerative disc here. This is grabbing my hand. Yeah, thank you. We're just about done with her surgery. A lot of scar tissue right there. You see that white stuff? That is very thick scar tissue. And it's got calcium in it, dystrophic calcification. By the way, the normal annulus does not have scar tissue and it does not have calcium. So the calcium is a bit unusual to see. And you don't see it with normal disc. You only see it when there's damaged disc, when there's disc injury. Good job, Jordan. How many seconds? Jordan. How many seconds, Jordan? All right. Thank you. Who's that behind you? Come in. Everything okay? She rushed up to the door. I thought there was some problem. Is the other patient gone or are they still here? Oh, good. Yeah. Right, wonderful. All right, done in, 1 minute. Dr. B, 1 minute. This disc is a bit weird. It's a lot worse than it looked like on the MRI. Like scarred up. But there's not a lot of herniation left for me to take. Just mostly inflammatory tissue. There's a little bit of fat. only zapping it because it's getting in the way. I can't see. So, but normally we don't take the fat out. We leave it alone. Huh? Yeah. Pretty much done though. This is the last part I got to do right here. This is the painful part of the tear. So my son is coming home for Thanksgiving. Very happy about that. His break? Yeah, it's a great question. I don't know. He just produced a video. Yeah. Henry, did you see that video?
I did. I was just about to mention that. I loved it. The way it was colorized and just the quality of it was really good.
Yeah.
He has a
You
really
should
good
tell
eye.
him. You should tell him.
I know.
He would love to hear from you on it.
I was caught up in the middle of something last night that when I saw
Yeah,
that I
no
was like,
worries.
but yeah, no, he killed it. I'm like, he's got a really good eye. I can tell.
Yeah, I was so impressed. I thought it was a professional video. He did it for his they call eating club. At Princeton, they have clubs where I thought they were eating clubs like you go eat food, you know. It's like, hey, how much can you eat? That's my kind of eating club, right? But it's actually a club where people with similar interests eat together and share ideas, you know. So they have eating clubs for molecular biology, eating clubs for whatever, film and theater, you know. So he did that for his eating club, which is a finance club. They're trying to recruit people to their club, you know what I mean?
Oh, and they needed a video to kind of show
He
that.
used the video to show that.
That's awesome.
So.
We're gonna use paper tape with a 4x4. That's it. Paper tape, yes.
All done.
Thank you.
Got a Raytech here. Just leave it. All right. Well, we're done. You can end the stream, and she did great.